Great, thank you too, and thank you, Julia. Thank you, Nina. As mentioned, my name is Swati Sharma, and I work with San Francisco's Department of Environment. Next slide, please. So at the Department of Environment, also known as SF Environment, we aim to create visionary policies and innovative programs that promote social equity, promote human health, and lead the way toward a sustainable future. I work in the commercial toxics section where we work with businesses of San Francisco. Since exposure to chemicals at work can be a major health issue, we help businesses implement environmentally responsible practices and recognize them for their efforts. Next slide, please. Today, I will talk about why we started the program, how we implemented it, and how it has helped. Next slide. So Julia and Tu spoke about the why. The reason this issue was that why did San Francisco decide to work on this issue? So our why was because we looked at the community. We looked at how we had 250 salons that employ about 2,500 nail technicians. About 95% of these nail technician community are Vietnamese, and they're extremely entrepreneurial and enterprising. Many open their own salons and work alongside other employees. We knew that many educational programs and outreach had been done to this community, but there hadn't been much recognition. So as a city agency, we wanted to recognize these salons for their efforts and also help build the community and invest in it. Next slide. Julia spoke about our ordinance already, so I won't go into too much detail. However, this ordinance, as she mentioned, it established the criteria, the products, and the training that San Francisco Department of Environment conducted. In San Francisco, there was really no need to pass an ordinance. We could have done it as a voluntary basis. However, we felt that establishing an ordinance and regulation gave it a solid foundation to work from, as well as a good boost from publicity to start the program. Next slide. So until 2011, outreach had been conducted to nail technicians, but as I mentioned, there hadn't been a recognition program and incentives hadn't been given to these nail salons to change out their products and practices. At the Department of Environment, we held broad stakeholder meetings that included nail technicians, salon owners, manufacturers, advocacy groups to solicit their input for a successful program. We received a lot of input, and I have to say, too, with CPIC and Julia with the Nail Salon Collaborative, were so important in helping us shape what this program was going to look like. Based on the feedback we received, we embarked on a process to research products and create a program. We knew there would be more to do as this program grew, but no one could have warned us how much. Our hope was that we learned to remove the barriers as they came and that other cities would then implement our program, and that's exactly what has happened. Several other cities have then adopted this same program. Next slide. Next slide, please. So our first step was evaluating nail products. There were chemicals and nail product formulations that were toxicants and regulated by other countries. However, we wanted to see what was actually being regulated here in the US. So we did research on several of these nail products, looked at them for carcinogens, mutagens, reproductive toxicants, short-term, long-term health impacts. And from there, we composed a shorter list of ingredients that we wanted to phase out. Next slide. Once the research of the products had been done, our next step was to create the program. And in February 2012, we passed our regulations to create the Healthy Nail Salon program. This program was the first of its kind in the nation, and SF was the first county in the nation to create an incentive-based recognition approach. There had been several other educational programs that existed that we built our program on top of, but this was the first recognition and incentive-based program. The program consisted of 10 criteria that salons must comply with, which included a training program in order to get recognition. So let's take a look at this criteria. Next slide. This is an overview of the criteria to become a healthy nail salon. It included products, practices, as well as improved ventilation. From the stakeholder process, one lesson we learned was that it was not just about having a safe list of products. There was a lot of questions around safer practices as well as improved ventilation, so we knew that this had to be part of the program as well. Next slide. As Tu already mentioned, Toxic Trio was very important to us as part of the program. The first criteria was to use polishes that were free of toluene, dibutyl phthalate, as well as formaldehyde. Next slide. So many salons use Toxic Trio free polishes, and all of the salons in our program use Toxic Trio free nail polishes, but it went far beyond that. It also included safer top coats, safer removers, as well as safer thinners. Next slide. The second criteria was to use safer nail polish removers. So nail polish removers could be acetone based, but could not be ethyl acetate or butyl acetate based. Even though acetone was not a desirable nail salon chemical, the non-acetone removers, such as methyl ethyl ketone, were much more harmful than acetone. The third criteria was to avoid using thinners unless absolutely necessary. So thinner is basically a chemical that goes inside the nail polish to rejuvenate the nail polish after it thickens over time. So in this case, we requested that salons not use thinners that contain toluene or methyl ethyl ketone. Next slide. The fourth criteria was to wear gloves. Gloves must be worn whenever handling salon products. We suggest using nitrile gloves for all products except for when acetone is being used for a long period of time, and then at that point they can use latex-based gloves. For most salon products, nitrile gloves are protective yet tactile, but they do disintegrate when exposed to acetone. Other protective equipment that we also suggested but are not required are long sleeves, safety goggles, as well as N95 masks. Next slide. So healthy nail salon technicians wear gloves while handling chemicals. Many of the salon employees actually found it odd to wear gloves at first because many customers would ask them why they are doing this. They also felt that it was not a good grip for polishing with gloves on. So over time, we've educated them, learned different techniques from them, and educated their customers to encourage them to continue to wear gloves. We've actually handed out little pamphlets also to nail salon technicians so that they can show their customers what this Healthy Nail Salon program is all about and why these technicians are actually wearing gloves. This has also encouraged them to wear N95 masks when sanding down artificial nails. Next slide. The fifth criteria is to have improved ventilation in salons. General ventilation is discussed during the training to tailor to a particular salon. Our ordinance only addresses salon ventilation where artificial nail services are provided. Now we are asking salons to go above and beyond the ordinance requirements by ventilating all areas. A lesson learned here is that having an ordinance-based program is not as flexible as you might think. And in San Francisco, we have some unique challenges as well as advantages when it comes to ventilation. The temperate climate means that there's no need for air conditioning or an HVAC system, and many salons keep their doors open 6 months out of the 12 months for cross ventilations. So each ventilation is kind of tailored to each salon. Next slide. The sixth criteria, as I mentioned, is to install a mechanical ventilation system if the salon is doing artificial nail treatments. Better ventilation means having a portable ventilation unit for doing artificial nail treatments. And the ventilation units that we recommend and have provided for many of the nail salons is a charcoal filtered air ventilation system that passes air through the activated charcoal and recirculates the clean air into the salon. What you see in this picture is a portion of the ventilation unit. We've provided 100% rebates for ventilation units for the first 15 salons that were qualified into our program. However, currently we don't have additional funding to provide to nail salons, so any nail salon that is participating in the program needs to purchase the ventilation unit on their own. And the cost is anywhere between $800 to about $1,500. So this is a significant investment without rebates, and we're concerned that this requirement might be cost prohibitive for many nail salons to join the program. Next slide. So the 7th criteria is to train all salon staff. The criteria makes sure that our hands-on training would provide salon and employees with multilingual training manuals, eye goggles, dust masks, as well as a box of nitrile and latex gloves. We require every salon employee, that includes owners, receptionists, cosmetologists, to participate in the training for salons to be recognized. We feel that inevitably all employees are going to handle these chemicals at one point or another, so it's very important that every single staff person in the salon be trained in our criteria. The training includes program criteria, safer chemicals, safety and protecting health, as well as greening their salons with energy and water efficiency, as well as waste disposal. Next slide. At first, many owners wanted to evaluate the trainings before signing on, so we started bilingual centralized trainings that were open to all, and the trainings were conducted in Vietnamese as well as in English. Next slide. Once we gained trust from the nail salon community and they saw us as a helping hand, the employees and to their businesses, they began to sign up. And so currently we offer trainings in either Vietnamese or in English at the salon itself, or wherever the salon owner and manager feel most comfortable. The salons are also given technical assistance on what to buy, what to avoid, and what they can purchase from their supply stores. Next slide. The 8th and 9th criteria is to allow SF Environment to conduct air monitoring. As Tu had mentioned, we had partnered up with EPA as well as Cancer Prevention Institute to conduct an air monitoring study to see the effectiveness of our program. The 9th criteria is to commit to trying safer artificial nail products. This criteria, currently we don't have any safe alternatives when it comes to artificial nail products, but we're hoping in the future manufacturers will change their formulation when it comes to artificial nail products. And the 10th criteria is to not use products brought in by customers unless they meet the program criteria. Next slide. As for artificial nails, technicians should not be asked to pay the price of beauty. We currently educate salon technicians on artificial nail products and how currently there is no safe alternative for them to use. However, artificial nail treatments as well as gel nail treatments are the bread and butter for these salons. So not providing these services is really not an option for them. The criteria to use safer products. Our research also shows that, unfortunately, manufacturers do not have any plans to phase out any of these harmful chemicals. And until that happens, we unfortunately cannot provide any alternatives to the nail salon community. Next slide, please. We conducted multilingual outreach to recruit salons into the recognition program. We went door to door to all of the salons as well as several of the community centers. Next slide. As I mentioned, we have about 250 to 280 nail salons in San Francisco, and so we actually conducted outreach to them twice. We also contacted local community organizations, temples, churches, to spread the word about our program. And so it was a real community effort to enroll at least the first set of nail salons. After the first 10 nail salons enrolled in our program, it really became a word-of-mouth program, as well as still conducting door-to-door outreach. Many technicians work at multiple salons, so oftentimes we would train one nail technician at a salon that was going through our program, and they in turn would go back to another salon that they were at and tell the other owner about the program to spread the word. Next slide. We also mailed out postcards as well as brochures about the program to spread the word. Next slide. As I mentioned, we also provide additional resources to the nail salon technicians and the nail salons with starter kits of gloves, masks, protective eye goggles, as well as a material safety data sheet binder, as well as a training binder that they can refer to. In fact, sheets are in Vietnamese as well as in English. Next slide. At the completion of the program and training, all nail salon technicians are given a certificate of completion. Next slide. In addition, we publicly recognize all of the nail salons that have participated in our program. This is a picture from one of the press events that we conducted, and recognition is a very important part of the program. Next slide. Many of the owners were interviewed by local newspapers as well as TV agencies. Next slide. We also provide window decals, posters, brochures to promote themselves. Next slide, please. So once we had a critical mass of 23 nail salons, we conducted an consumer outreach campaign earlier this summer. So these are some pictures of the bus shelters that we had and some of our website. We had gotten the word out to the nail salon community, but we also wanted to bring in business to these healthier nail salons. And so our outreach campaign called Pretty Shouldn't Stink included multilingual web pages, Facebook ads, bus shelter ads, and it was very important to us to get the word out to San Francisco that these salons are the pioneers and they're going above and beyond to use safer products. Our hope is that consumer campaigns not only drive more business to recognized salons, but encourage customers to ask their salon to join. As more salons hear about the program, they call us and enroll. Next slide, please. So now I'm going to talk about staffing and budget. To run a program like this, we had a small staff as well as a small budget. And the ongoing total budget is about $10,000 annually, as well as 1/4 full-time employee. To initially set up the program, it did cost a lot more than this, and it did require a lot more time. One thing that's been very integral to our program is to have multilingual staff that we've hired on. Currently, our contractor, Min2, has brought in her expertise of not only being a nail salon technician herself, but also working for Cancer Prevention Institute and being able to give that experience as well. She's helped us tremendously in terms of communication, training, and building that relationship with the nail salon community, and it's been vital to the growth of our program. Next slide. There's always an optional budget to provide additional ventilation units as well as additional time in research. So this is just kind of a summary of if additional research wanted to be conducted, it's possible to invest almost up to $90,000 into this program. Next slide. So here are a few elements for the successful program. It's multilingual staff, multiple staff members, organization, flexible hours, patience, and a lot of passion. I have to say, especially the first set of nail salons that entered into the program. There was a lot of passion behind them, and when we receive so much praise from them about how this program has made a difference, it really allows us to kind of go to the next level. So a lot of it is the passion of not only the staff that runs this program, but the nail salon technicians, owners, and managers that have signed up for this program. We have a white paper that outlines our entire program, bumps in the road that we had, details about staff, budget, as well as our research, and this link on top will take you to our white paper. Next slide. So what does the future hold for us? Our goal is to continue to recognize salons and affect policy change. Currently, we have 30 nail salons that are recognized in our program, and we have about another 14 that are in the pipeline. And we've trained about 400 nail salon technicians. When we first started, our aim was to affect change in policy, better products, better disclosure, and greener chemistry. The efforts became more and more grassroots, and we have created a proof of concept. And this program has been adopted by several other counties, as Julia mentioned. This is proof enough that salons can be safer and survive and even thrive in a competitive marketplace. Our next step is to make sure that this proof of concept gets converted into policy throughout the U.S. Next slide. So if you need any more information, here's my contact information as well as our website on top. Thank you.
Thank you so much, Swati. Next, you will hear from Xiao Qi on New York State's response and health center's approach to this issue. Xiao Qi?
Great. Thank you, Nina, and thank you to Julia and Swati. The presentations were very, very helpful in terms of setting the context. Hello, everyone. My name is Xiao Qi Sim. I work for the Charles B. Wen Community Health Center, a fairly large federally qualified health centers that's based in New York City. We have clinical sites in both Manhattan, Chinatown, as well as Flushing, Queens. I guess, before I start, just wanted to let people know that in comparison to California or Oakland or San Francisco, New York definitely is not there yet in terms of policy, research, and product development. I think to a large extent, because of the New York Times article, there have been a series of activities, of policies, and laws being passed in New York State, which I will go through and talk more. I think my presentation, rather than focus on more the health and occupational health aspect of the nail salon industry, I want to spend a little bit more time talking about the role of mainstream and community media, and also, how the community is really trying to navigate, the mix of politics and policy in light of the New York Times article. And I think I want to tie, the two major controversial aspects, of the law right now, which is the minimum wage enforcement and the wage bond issue that's facing the industry, and how it has somewhat become very threatening, to the nail salons businesses. So I think with that said, let me go back by giving you the context about the Asian American population in New York City. Next slide, please. In New York City, as many of you know, there's about a little bit over 1 million Asian American populations in New York City, and Chinese Americans consist of about half of the populations, about 500,000. The patient population that we serve at Charles B. Wen Community Health Centers, roughly speaking, we serve close to 50,000 patients as of last year, individual patients as of last year, and about 230,000 visits. Our health center has been around since 1971, and we have been funded as a community health center since 1977. And we offer a range of primary care services from internal medicine to pediatrics, OBGYN, dental, mental health, social work, as well as health education services. And most of our patients are Chinese Americans, spread throughout the 3 major boroughs in New York City: Manhattan, Brooklyn, and Queens. And the mission of our health centers is to eliminate health disparity, improve health status, and expand access to the medically underserved with a focus on Asian Americans. Next slide, please. As we were, trying to get a better understanding about the industry, the nail salon industry in New York State, we were able to track down some of the data that's being reported by the Nails Magazine Industry Report. Basically, based on the data, there's about close to 4,000 nail salons and about 16,000 nail technicians in New York State. And New York also falls among top 5 states with the highest employment level and concentration of jobs in the manicurist and pedicurist occupations. However, it's widely assumed that this number is underreported, and it's been reported in a lot of the community media that the nail salon businesses probably somewhere closer to 10,000, or at least 8,000 or 9,000. Next slide, please. In terms of the another important context for one to understand the nail salon industry in New York is that New York City Asian community is very, very diverse. As to the best of our knowledge, so far, the group and the ethnic communities has been very active in terms of organizing nail salon workers is the Nepalese and the South Asian communities. In fact, the nonprofit group called Article for Human Rights and Social Justice, they've been doing a lot of organizing work, as well as a research report, interviewing and conducting focus group with 198 Nepalese-speaking nail salon workers. Some of the key findings from their report are things like extreme hours of hours for labor, for low pay, some reported health problems as reported,
about the right kind of gloves and the right kind of masks and good ventilation. I mean, it's just like basic stuff like that, and it makes me think, it's just like.
Sorry, should I continue?
Oh, right. And so what they said is even just getting them to wear the gloves every time.
Okay. Xiao Qi, we're gonna find out who's.
And it's all women in childbearing years, and some of the stuff is not on the MSDS sheets. It's been approved.
Folks, please, if you can, mute your line. Thank you. 1 second, Xiao Qi. Okay. All right. You can resume.
Okay. As mentioned earlier on, in a published report released by Article Behind the Polish, they documented very similar issues, as mentioned in the previous presentations, things like low pay, health problems, very low protections for the workers, as well as health concerns. Next slide, please. Okay, this slide basically trying to detail, the series of events, in New York State politics, and in terms of the divisiveness between the state assembly and state senate, which is controlled by 2 different political parties. It's really amazing to see how fast the law was being passed and also signed by the governor. Literally in the span of 2.5 months, from the first time when New York Times released its nail salon series, both the governor and the mayor announced separate multi-pronged efforts to reform the nail salon industry in New York, and got a lot of different city and state agencies involved, as well as separately a number of notable Asian American elected officials in New York State, such as Congresswoman Grace Ming, New York State Assembly Member Ron Kim, and a number of other business leaders and organizations have taken action to form a healthy nail salon network to address the problem with the industry. In June, both the state Senate and the Assembly passed 2 legislation to improve the working conditions in New York State nail salons. And then The law itself was officially signed in July as one of the few successful three-way agreements in 2015. Next slide, please. I think I'm going to spend a little bit more time going over these slides. I think this is probably one of the major content, that you all should understand. In New York State, I think a lot of the focus, they are addressing some environmental and safety concerns. I think they're putting a lot of emphasis on minimum wage enforcement, as well as the wage bond issue, which is very, very contentious right now in the state. Basically, in terms of the equipment requirements, the New York State, is requiring nail salon businesses to have properly fitted N95 and N100 respirators, as well as protective gloves and eye equipment. They are also requiring the businesses to post a nail salon bill of rights, which is attached on this PowerPoint slide. In that it mentions specifically about the minimum wage requirement, as well as what employers should never do, and what what type of things they need to provide to the workers. Ventilation requirement is another major one, as well as notices of violation. In terms of bond or liability insurance, this is a mandatory purchase. Basically, what the state is requiring is that businesses must maintain liability coverage in the following amounts: accidental and professional liability insurance of at least $25,000 per individual occurrence and $75,000 in the aggregate. So, wages legally due to employees who provide nail specialty services of at least $25,000 if the business owner employs about 2 to 5 full-time individuals who perform nail specialty services, and so on and so forth. The issue that really come up and it's really facing a lot of resistance right now in the nail salon industry here in New York is that in early August, even a few weeks after the law was passed, the New York State Department of Financial Services certified in writing that wage bond products is only available based on the 4 to 5 wholesale companies and 5 to 7 bond brokers that they have identified. However, think about the context. We have a minimum of about 4,000 nail salon businesses to about 10,000 plus businesses in New York State, and the entire industry, insurance industry, was really unaware of this product. And when they finally called up, they realized that many of their clients did not qualify to secure a bond. Bond brokers and bond companies often measure risk based on individual credit, assets, and financials. And I think it's well known to us, in work in the Asian community, that many of our immigrant-run small businesses do not have the credit or credit history to qualify. Right now, the pressing deadlines the businesses are facing is that by October 6th, the New York State Department of Financial Services will begin a round of unannounced site inspections if it's found that they do not purchase the bond insurance for their workers. They're going to be facing potentially facing penalty, as well as eventually being shut down. So this is going to be a major issue in the New York State and the New York City nail salon industry. Next, please. Next slide. I think something that I did not put on the slide that I'd like to spend some time talking about is that ever since the New York Times article came out, it really has forced a lot of the nail salon businesses and workers, started to talk to each other, started to get organized. And what's really amazing is that literally in the last month or so, again, through the wonderful world of social media, through the Chinese language social media outlet called WeChat, the Chinese American Nail Salons Owner Associations was created literally in the in the span of days, if not weeks, if not days. right now they have a membership, I believe, between 600 to 800 businesses, and they're very active in organizing and also in negotiating and talking to both the state legislators as well as the New York State, the various different New York State agencies. What we have seen over the last month or so, again, through a lot of the coverage from the community media, is that the association is now very actively organizing the businesses, and they really have a huge issue with the wage bond issues. And they are also working very closely with the State Department of Labor in terms of figuring out what is it that they need to be in compliance for. But I think the issue with them, the major issue with them is really the wage bond issues. They even organized a couple of major protests in front of City Hall. They even went to the New York Times building, to really protest, I guess the so-called fairness or representativeness of the article. Definitely, it has caused a lot of uproars, in the community, and I think many businesses are worried about the prospect of, being shut down, and their, just inability to purchase the wage bonds. This is a very, very fluid situation, both in terms of the politics and the policy front. What our health centers has been doing is that, recognizing that we are major stakeholders in the community, we wanted to continue to work with the New York State Department of Labor, Department of State, and Department of Financial Services, provide them with a venue, to continue to, educate the community about, what they need to look for in terms of the new nail salon law. We are also very actively working with various community organizations in the New York City area. Among them are places like, Asian American for Equality, the Minkwon Center, Artica, and the New York Committee for Occupational Safety and Health. And we understand that, one major role is that, community media really, has a huge role to play in this. And we continue to work with them, to educate the larger nail salon industry and the workers. Another aspect of our work is that we've been reaching out to the Mount Sinai Occupational Health Department, really trying to get more expertise in-house, because as a community health centers, we are not an occupational health expert. We definitely see the need to collaborate and to partner and learn from each other. I think another point I wanted to bring up is that, this is not just an issue for the Nepalese community, not just an issue for the South Asian community. It's a huge issue for the Chinese American community as well as the Korean American community. I think the problem itself, actually has created, a lot of great collaboration opportunities and partnerships, for the various organizations. And what's great about the environment here is that we do have, a number of number of well-respected elected officials, both on Capitol Hill, in the State House, and in City Hall. And we'll hope to be able to continue to, stay in touch, with what's going on, and also continue to monitor the situation in the community. Yeah, I think that's it. That's the end of my presentation. Thank you.
Okay, thank you, Xiao Qi. Please note, we will begin our Q&A period, and if you have questions, please enter your question or comment in the chat box, and we'll make sure to address it. So the first question I have really is open to all the presenters, and that is, what can other communities do to start a similar program for their nail salon workers or nail salons in their communities?
Hello? This is Julia. I think there are several ways that nail salon programs can be started in the community, so it just depends on what level. I think on one level, particularly with the Healthy Nail Salon Recognition Program, because of the great partnership that we've had with the San Francisco Department of Environment, there are so many tools and resources that are already there that can be used. So if there is a county or a city that is interested in implementing such a program, we have the talking points. There's also, in terms of the materials that Swati has gone through, the criteria is already there. The materials, we have a very active Healthy Nail Salon working group of all of the counties and cities that provide support and resources to each other. So that is available to anyone if there are any county or cities that are interested in this. I think on a very local level, if you're a community health center wanting to really try and implement like a program for your patients who are nail salon workers, Asian Services, we also have materials that we use in our clinic in terms of brochures and also the types of workshops that we can share as well. And happy to also share strategies about outreach if that's something that folks are interested in. And then I think on the policy level, I do feel like on that part, there can be advocacy. If you are in California, there will be hopefully a legislative package of bills that comes out that supports healthy workplaces, and also potentially some federal legislation as well. So if you are interested in keeping abreast about that, feel free to contact myself, and we can put you on the listserv that will be keeping tabs on all of the moving parts.
Thank you, Julia. Would anyone else like to add? Okay, so we have Julia's and the other presenters' contact information on the presentation, and the presentation will be sent out to all registered participants after the webinar has concluded. So make sure you are registered, and also if you would like a copy and you're not registered, please email us. The next question I have, I think it was an earlier question for two, is can you further define endocrine disruptor?
Yeah, I think that's a term for things that does affect a woman's endocrine system. And the work that I do has a lot to do with cancer, particularly hormonally mediated cancers like breast cancer. So a lot of times if there are chemicals that would either affect, hormones within a woman, we always have concern about what that means for women's cancer risk. In addition, if you think about estrogens and such and chemicals that can interact with that during pregnancy, it becomes a huge concern. So when we look at diabetes phthalates and during the pregnancy stage, so much of it is dependent upon the hormones that are in there, your estrogen level and such. So we worry about your exposures during those critical periods of your life, such as during pregnancy. I hope that answers it.
All right, thank you. The next question I have is, what role can the media or press play in highlighting issues that affect these populations? And also, what are some considerations in really using such strategies? And this is open to all the presenters.
So this is two, and maybe I'll start off, and I'm sure my colleagues would definitely jump in. It was really interesting when the New York Times reporter approached Julie and myself in terms of wanting to do a story on this. She was from New York and wanted to focus on New York, but I had heard a lot about sort of the work that's been going on in California. And we have gone a fair amount of media attention on these issues, both within our state as well as nationally, and had been in the New York Times. But we weren't expecting sort of the attention that this really drew, although the reporter did tell us. So we worked with her for months and really allowed her to meet some of the workers and owners that we've been working with. And I think the nice thing about the article, and to her credit, was she really highlighted sort of the issues and the urgency around health and safety, as well as some of the labor issues. But again, with a lot of reporting comes sort of focusing on sort of the worst cases. And we want to emphasize that we've been concerned about the chronic health conditions for nail salon workers and owners for a good 10 years in our work. And so we really were applauding her for highlighting that and sort of really highlighting some of the cases that we have come across. And it really did do what investigative reporting does, which is really grab the attention of the public. And she really, I think, the New York Times article really did that. I think what we really hadn't prepared for is sort of with the attention, these so-called emergency responses that we were hearing from some of the governmental regulators. So, I think, in some of the media interviews afterwards that I spoke on, I said, I think it's wonderful that New York government is really being quick to respond to this, and I really applaud them. I think what we were concerned about is that in a lot of these emergency responses that they were quick fixes to really a complex issue. And then, Julia and myself and a lot of our collaborative members were on a series of interviews afterwards that spoke about, are these abuses happening, at all salons, and really wondering about what to do. And it really affected the workforce here in California. And while we do think that there are egregious violators when it comes to owners and in terms of health and safety violations, we don't think that this is happening intentionally in all of the salons. So wanting to really promote this more of an incentivizing approach and not just a punitive, because we've seen how the punitive has played out, both in California when they were working with the Board of Barbering and Cosmetology, where the way to make changes is all through citations. And our approach has been that, in many cases, when you're dealing with some of the immigrant owners, that they often were employing their families and their own community members, their friends into this. And yes, there is a need to educate them on sort of the best practices rather than penalize them up front. I think Xiao Qi's presentation in highlighting some of the context of what's going on in New York was really helpful, because it told us really that when we start putting out these big legislation, you really have to really understand deeply what's going on and its impact on small businesses and in these small businesses communities, particularly immigrant communities. We overall were really concerned about the immigrant backlash when a lot of this came out, and I think in the future we wanted to prepare more around that and working with our partners both nationally as well as locally, so that, one, the community is prepared. We wanted to draw the attention to the issue, but not scapegoat it on the owners and workers alone. That, in the work that we've been doing, we've been highlighting the manufacturer's role in this and putting a lot of the chemicals in the products, as well as consumers in being able to push for better and safer products just by their buying power. So I just wanted to note that I think, what Xiao Qi spoke about in terms of the ethnic media and how to mobilize them so that they are getting out the right information and preparing our community so that when these stories come out, that we know how to handle them better than we did with the New York Times. We really try to ride the momentum, but I think we could have done a little bit better in preparing sort of the potential immigration backlash that was happening.
Yeah, I just want to add that, given, the attention the New York Times article has been getting, as well as, the rush to, implement or enforcing some of the laws and regulations, it has really come down to, like what Tu was saying, that is this, a backlash, against immigrant community, or is it, really, like, we are, just go according to the rule of the laws and, trying to implement, all those, rules and regulations. I mean, for instance, well, we don't have direct evidence to show this. It was reported in the Chinese newspaper here that not in New York State, but in Connecticut, the Connecticut government agencies, it's been trying to enforce their minimum wage requirement in some of these nail salons. They did an unannounced site visit to 25 salons in August, and they actually indeed did close down 23 of them. This is really, really threatening to the business owners. And I think to a large extent to the economic survival of the businesses. There's absolutely nothing wrong trying to push for minimum wage standards, trying to push for more safe and environmentally protected work conditions, as well as the wage bonds, which would have been great for thousands of workers, if their businesses were out of were forced to shut down. But at the same time, I think we need to do we need to do it in a very sensitive, in a very incremental way. And I think this is, as I said before, this is a very, very fluid situation. We are still at the heat of the moment right now in terms of figuring out, how the state is going to be reacting to the community kind of discontent or unhappiness, and vice versa. So with all good intentions, I think as a community health centers, we just have to stay on top of it. And this is the community that we live in. Perhaps, many of our patients, many of our family members, do have some, whether, run a nail salon business or have, some of our friends working in the nail salons. So I completely agree with Tu.
Mm-hmm. And just really quickly, I think, Nina, when you asked about the question about what could the media really focus on, and I think what was missing from the conversation a lot was around sort of the consumer piece and what roles the consumers can play in all of this. Because when we think about how much manicures and pedicures cost and how affordable they are, again, I think consumers also can play a huge role in that, and I think that has, again, been missing in that part of the conversation, as well as what Tu and Xiao Qi have been talking about, and really around this as an immigrant business and that perspective, being family owned, and again, this is really their economic cornerstone. So I think there's still more important key aspects to be highlighted in the media that we hope can be distributed and more widely spread.
Thank you, Tu. Thank you, Xiao Qi, and thank you, Julia. The follow-up question, which is sort of related to the first question that we had, was, so what role can FQHC, specifically in areas with a higher density of nail salons, play to really promote nail salon worker health and safety?
This is Swati. I would say from kind of the local government perspective, I would look at local health agencies or environmental agencies and just see if this is something that's of interest to them. And I know it can be daunting, it can be overwhelming at first, but as Julia mentioned, we've done so much of the groundwork already, and so of course, it's going to take time, energy, and money to implement this type of program in several areas, but so much of the work has already been done. And since we have a great group of people that meet and talk to each other regularly, we can kind of go through the bumps in the road. So there's a lot of resources available. So I would say first step is contacting local government health agencies to see if there's any interest on their part.
Mm-hmm. And then also at the level of the community health center, I think that it's important to be able to reach out to, if you have a lot of patients who are working in the nail salon industry, again, as Wes said, we also have tools here at Asian Health Services that we've used in being able to educate our patients here, and as well as the community, and working with the collaborative very closely on really shaping those. And so we have them translated. Again, please tap into us. We would like to put together a toolkit that we can distribute, but we do have all of that. And so I think being able to reach out and also to be able to even just host a small workshop and hear what are the issues. And we have binders and lots of great brochures as well that easily can be tailored to your community health center. So please contact us.
And I would just add, I think a lot of times when people start on this work, because of the complexity of the chemicals, it can be intimidating. I think through the California Healthy Nail Salon Collaborative, we established a research advisory committee that I want to say is just an awesome committee of industrial hygienists, of chemists, of all folks who have been able, when an issue comes up, like when the gel polishes came up, been able to look at it and be able to delve really deep into it. So we have the infrastructure, not just through sort of the developed materials, but really being able to really monitor the situation, especially in a service sector that's sort of constantly a moving target when it comes to the different types of products that are being used and the different trends that are coming up. So we feel pretty confident in terms of being able to help work with sort of the national collective when it comes to trying to get the information out and very relevant and timely information out.
And sorry, one last thing too. You know, there is a National Healthy and Nail Salon Beauty Alliance that is convened through the California Healthy Nail Salon Collaborative and Women's Voices of the Earth. And you know, if you are outside of California, that is a great way to start being involved and to be able to be updated on what are the issues, but also being able to support new members to be able to move forward with new activities and initiatives. So if you want more information, I'm happy to provide that as well.
Great, thank you, Swati, Julia, and Tu. The next question is, how can nail salon workers bring these issues up with their employers?
So we do a lot of these trainings. I guess if it's with regards to whether it's health and safety and labor, we have worked very closely with the UC Berkeley Labor Occupational Health Program in being able to really tailor some of these trainings to have folks practice, you know, how do you bring up these issues? And again, it is a very sensitive issue. We are going to be working on a training that does talk about how can one engage in small steps. And I think it's also a lot to do with educating the owners as well. So again, we have some of those resources within our trainings that we can provide and share.
Great, thank you. And then what can consumers, Swati, you had mentioned previously doing a consumer campaign-oriented campaign, and so what can consumers do to bring more attention and also promote worker health and safety?
I think with consumers, it's asking the right questions. It's about supporting your nail salons. If you're in a county that currently has a program, asking, you know, your salon or the owner or manager to participate. And then if not, it's also just about promoting safer products. So questioning what products are being used. Are they using toxic trio-free products? You know, are they, as an owner or manager, protecting the health of their employees? So it's about getting that awareness that consumers do want safer products and practices, and consumers do care about their technicians. Actually, one of the technicians that we were speaking, actually one of the customers we were speaking with was telling us that she has been going to the same technician for the last 15 years. So there are many consumers out there that have developed a very personal relationship with many of the nail salon technicians. They care about their health. So as a consumer, asking and demanding for safer products is the first step.
Mm-hmm. And I also think that if your county or your city does not have a healthy nail salon recognition program, consumers, you can also go and ask your local city elected official, your city council member, that if you feel like this is an important issue, that this should be taken on, because there's always been a champion within these local jurisdictions who understand how important health and safety is for nail salon workers. So that is also another avenue to in addition to, you know, educating your own local nail salon that you go to about these issues.
And I would just add that, you know, in terms of our research studies, we've done a series of focus groups and interviews with the workers and owners. And, you know, so many times they said that the big driver when it comes to how they run their salons are the customers themselves. So there are things that we could do as customers to really ask for the safe alternatives. But then there are other things that we could not do. So one of the, you know, when we were doing the Healthy Nail Salon program and trying to get people to wear gloves and understanding sort of what the gloves mean, again and again, we were hearing from workers and owners saying that customers would see us put on gloves and think that it's a reflection on what they think of their hygiene. So really understanding that a lot of the practices that we're encouraging salon owners and workers to do is not really just because there's any forms of discrimination for the customers, but really to provide health and safety for the workers. And I think it's really important for consumers to know that. And then not just when you visit a salon, but your buying power when you go into any of the stores to do your home care manicures and such. Buying products that are considered safer, that says toxic-free or free, really sends a message to manufacturers that there's a high demand for this, and that helps in several ways. That helps them create more, and that becomes cheaper, so that when salons are switching out to these safer alternatives, it's not sort of an economic burden for them. So there are things that you can do as a customer as well as a consumer at home.
Thank you, Swati, Julia, and Sue. And the final question that we have is to all the speakers, actually, if you are aware of any other legislation outside of California and New York, are those states with large populations of Asian male workers?
No, the only state that I could think of was, the example I cited early on in the state of Connecticut, where they were targeting a lot of the Asian American-owned nail salons businesses.
I know that there was also legislation passed in general with regards to ventilation in Washington State that said that, I think it was after, and I'm sorry if I don't know exact details, but after a certain year, I think it was 2007, that buildings needed to have certain HVAC requirements. So if there was a salon that was going to open after a particular date, that they were required to have HVAC ventilation. I think the issue around that has been, though, the enforcement. It's been really challenging. So I know that I've talked recently with one of the King County environmental health hazardous waste department heads, and she said that they're trying to do an analysis of the effectiveness of that legislation.
But we do think, I think in the past there's been pushes for federal policies that have gone down and haven't been passed, but it really was around cosmetic safety and really forcing manufacturers that create cosmetic products to report the ingredients that are in there, especially ingredients that are linked to cancer and reproductive outcomes. So I think more and more, even if they're not current policies, that we should be pushing for greater regulation when it comes to cosmetic safety. I really feel that this cosmetics manufacturing industry, they make so much money, but in terms of how they're regulated, they're not. I mean, in my opening slide, I really emphasize that, and I think we should be looking at federal policies that put more emphasis on monitoring what they use, because like I said, we could be really successful with a few chemicals and they could substitute something that's really harmful. So we really needed to understand all the different compounds that are being put in a lot of these cosmetic products.
Nationally, there is a bill that Feinstein and Xiao Qi have put together with regards to really looking at pre-market safety for personal care products and cosmetics in general. So I know that has been in the legislature and Congress for quite a few years, but I know that that will probably be brought up again, and it is moving through as we speak. I think that there is a little bit of standstill, but there is that legislation that folks are doing analysis on and trying to figure out where that's at right now.
All right, well, thank you very much, Xiao Qi, Julia, and Sue. This concludes the Q&A portion of our presentation. So, Nina, we're going to turn it back over to you for some concluding remarks. Great, thank you, Twin. Before we hang up, I wanted to ask speakers if you had any closing remarks that you'd like to make.
Well, thanks to APTO for hosting this webinar, and again, just another call out to folks on the call who are interested in joining our efforts and any interest in any of the programs. We are more than happy to share and help build any initiative that needs to happen and connect, because I think it is about building a larger movement together and being able to leverage all of our resources and skills together to really address this overall issue of health and safety for workers.
Thank you so much to Julia, Xiao Qi, and Swati for sharing your perspective and expertise and providing such rich information on this pressing issue. This concludes the webinar. Please complete the evaluation survey after leaving the webinar. Also, an email with a link to view a recording of the presentation will be sent after the webinar. Thank you again for participating in today's webinar, and goodbye.